Hi, this is Dr. Siegfried. Thanks for coming to my YouTube site. Today I want to share something with you that I've had recently with a patient who has a shoulder injury and a mid-back injury and a neck injury. And I want to explain to you the process that we've gone through to help him because people get injured all the time, and sometimes they think it's their shoulder when it could be their neck. Sometimes they think it's their neck when it could be their shoulder. The point is the neck, shoulder, and the mid-back and the upper back are all connected. So I'm going to explain the process here, how things can happen. This is the spine, as you can see, obviously, and these are the bones, and then there's nerves coming down through here, and then there's nerves going out into the shoulder. And a lot of people don't know that, or they forget, or they're not aware that there's nerves going out to the shoulder here, and there's the shoulder bones. Then there's the muscles. But for the moment, I want to focus on these nerves because this guy hurt himself at work pulling green chain, and he was pulling it so much he felt a pop in his neck and his upper back, and then his shoulder started to hurt. So now he's got both a neck, upper back, and a shoulder problem. But I want to point out the fact that when these nerves are pinched, that's going to lock up all these muscles. So I wanted to explain to you that part of it, and then I just want to show you, we've given him treatment and we've given him certain supplements, but I want to show you some of the home care exercises that I've given him that have been extremely helpful as well. So we're going to go into the other room and I'll show you those real quick. Hi. So I'm going to use some very simple exercises that this patient was able to use at home, and it helped him get back to work a lot faster. So here's a doorway, obviously, right? So now keep in mind his shoulder's sore here, his shoulder's sore, he's hurting here and up in here. So I wanted him to do some gentle stretching exercises. You may or may not have seen them, but I'm just going to show them to you because they're so simple. And they don't hurt very much either. So you stand up square in the door, and then you put your hands right here. And what you do is you just lean forward, put your feet about maybe a little bit more than shoulder width apart, and you just lean forward with your head back. Now you're going to feel that in the front of the shoulder, you're going to feel it in the chest, you might feel it in the upper back out into the neck. And the more relaxed you are, the more forward you can go, and you'll feel it sometimes even into the low back. And you do this for a count of maybe 10. 1001, 1002, 1003, 1004, 1005, etc. Okay, and then you come back up very slowly because sometimes it's sore enough that you can't really do a whole lot at first. Then you go to the next position, which is right here, and you get about the same position except for your arms, and then you lean like this and you count 1001, 1002. The more relaxed you get, the more forward you might be able to go, and the greater the stretch up in here. So that's the second one. The third one is you can, instead of being like this, you can actually drop down here, and that's going to put a little bit more strain on there. So again, you're standing just the way I'm in here, and you're leaning forward just to where you feel a little bit of tension, that's all. And you start counting, 1001, 1002, 1003, etc. Now, again, you're not trying to strain anything, you just go to where you feel a little tension, and then you relax back, and then you can go back and do intervals, like you just go back and do this again. But I just wanted to review those three, like this, like this, like this, and then the other one that I'm going to show you a couple other ones, like this, where you just hold your hands here like this, and you just lean forward, 1001, 1002, etc. And you're going to feel it up in here, a little bit lower, but it's very good, very gentle, and very dynamic for your shoulder. So that's that one. Now I'm going to show you another one a lot of people have seen in the gyms and the physical therapy, etc. You just stand in a corner. You can stand like this, and you can set your own pace again. You can go like this, you can go like this. I'm just going to show you this going down like this as well. So I wanted to make sure I showed you those, and then should you have a chin-up bar, you can, like this, you can hang like this, you can hang like this, or you can hang like this. Now if you're not tall enough, you can get a stool like this and go like this, put your feet on it, you again put your feet on it, you just bend your knees, keep your feet on it like that. So those are some exercises that you can do if you have shoulder problems, whether you're getting treatment anywhere else or not. You can just do them at home. But I want to assure you that when you get the adjustments to take the pressure off the nerves, things will go a lot better. So I hope this helps, and we'll see you on the next video.